Although there have been over 900 studies on the adverse effects of statins, incredibly a lot of people are on this classification of drugs. And today we just want to look at a few of the adverse effects of statins, especially in relationship to the hormones. We talked earlier in the hormone webinar about pregnenolone, this mastosteroidal hormone, and how all our sex hormones like DHEA, our testosterone, and our estrogens, and our cortisol and progesterone all come from pregnenolone. So this pregnenolone is a very key steroidal hormone and is something that we would definitely want to keep in balance with the rest of the body since everything seems to come from it. We talked also about how if we look upstream, we see that vitamin B5 and dietary fats are what the precursors to pregnenolone. And interestingly enough, cholesterol, and specifically LDL, is the cholesterol that pregnenolone comes from, especially if you have the liver enzymes present in the body, you're going to be able to convert the cholesterol into pregnenolone. Now, in regards to statins, what they do, they basically they literally cut off this conversion basically into cholesterol, where you're going to be lowering your cholesterol levels and you're going to thus lower your LDL levels, and everything on this chart is literally cut off. Not only your sex hormones, but also that anti-stress hormone cortisol. So one of the symptoms a lot of people on statins have is neuropathy or pain because they don't have their anti-pain hormone, or cortisol or cortisone. So a lot of people are going to have to go on some medication or something to deal with the pain. And obviously, since you're not producing your sex hormones like testosterone, things like that, you basically chemically castrate yourself. You're gonna have to go on something else to actually even be able to have a sex life at all. And this will also lead to depression. So that's a very common symptoms is pain, no sex life, and basically depression when people go on these are just a few things that happen when people go on statins. So perhaps it's time we look at these things a little bit more intelligently and start taking responsibility for our health and start living right.